Hello, True Health Seeker, and welcome to another exciting episode of the Learn True Health podcast. I can't believe it's already June. Can you believe that? Time really flies. I'm so excited for you to listen to today's episode because we focus on kidney health. Prevention is the most important thing. So if we can adjust our lifestyle and diet now to support kidney health, we can encourage our body to have a longer, healthier life, right? And by supporting healthy kidneys, as what's discussed in today's episode, you're actually supporting every organ of the body. So prevention is one thing, but if you have kidney disease right now, regardless of what stage you're in, you can do things to support optimal health. So no matter what, you can do things naturally to support yourself in achieving optimal health. And we discussed that in today's interview. Now, there's a few exciting things happening this month because Father's Day is coming up, and I've talked to my favorite health companies, and we have some really exciting sales for you for Father's Day. One really exciting sale is from my favorite sauna company, Sunlighten. I talked to them and talked to them and talked to them and whittled down a really, really great deal. So I'm very excited for you. So for the month of June, right now they're running some kind of special sale, but for Learn True Health listeners, on top of their already current sale price for their saunas and their solo systems, you're going to get, as a Learn True Health listener, $200 off your sauna and free shipping. Now, shipping for a sauna system, like a big wooden sauna system, is over $500. So they're going to take that, they're going to give you free shipping, and they're going to take $200 off. And if you get a solo system, they're going to take $100 off. And then usually in addition to that, for the Learn True Health listeners, they throw in some things like their bamboo towels and stuff like that. I really like the special non-toxic pad that you sit on in the wooden sauna. I love their 3-in-1 system. I've had several episodes about it. I've interviewed a cardiologist that uses saunas for heart health. I've interviewed the founder of Sunlighten. She talks about why she started the company. I've interviewed an employee of theirs that shares some really cool stories of success. The reason why I chose Sunlighten out of all the other sauna companies in the world for me to buy my own personal sauna from them is because they have a 3-in-1. So it's the full spectrum of light, whereas most saunas are just the far infrared. And this is actually, the Sunlighten is the near infrared, the mid-infrared, and the far infrared. There's benefits to healing the skin and actually reducing wrinkles, reducing scar tissue, decrease in chronic pain, decrease in inflammation on all layers through the skin and into the soft tissue. It also, you can sit in it at a lower temperature and get a really great sweat. So it increases your core temperature while still breathing comfortable air instead of breathing stuffy hot air. There are general benefits that everyone gains from using sauna therapy, such as decreasing stress, decreasing inflammation and pain, decreasing blood pressure, or stabilizing blood pressure into a more normal range. So all these things are great for overall health, but specifically about the kidneys. There's many articles in PubMed and other studies that you can find that show that healthfully using sauna therapy can benefit those with liver and kidney disease. One particular study showed that concentration of ammonia in the body was released through sweat, and that we also released urea through sweat, as well as high levels of nitrogen. So we were able to using sauna therapy, in the study, they were able to take the load off the kidneys by allowing us to sweat through the skin instead of having to have the kidneys do all the work. The reason why I bought a Sunlighten 2 years ago is because my doctor told me to. She said that my liver was having problems and that I should support my body in detoxifying. especially heavy metals. So I've been using a Sunlighten to detoxify heavy metals, but also support my body in releasing these metabolites like ammonia and urea through my sweat. So lots of nasty byproducts of our metabolism can be sweated out, and then we're giving our kidneys and our liver a break. Now, of course, if you're under the care of a physician for a disease like kidney disease, you should definitely work with your doctor, but add to your team. Find a naturopathic physician, find a functional medicine practitioner, find more doctors and experts to add to your team to give you different opinions, and of course, all science-based. Dr. Andrew Weil, who's a very famous medical doctor that specializes in holistic medicine, he is quoted as saying that he regularly tells his patients with liver and kidney disease to sweat in a sauna 2 to 3 times a week, that the increase in blood flow is so good for those organs, the detoxification that happens in the sauna, but also that it lowers blood pressure, and that's really great for the kidneys as well. So there's several reasons why sauna therapy is great for the kidneys, and I love that Sunlighten is a very gentle form of sauna therapy. But of course, work with your doctor and make sure that sauna therapy is right for you if you have a disease. There are some cases where sauna therapy is incredibly beneficial, and there are some cases where it's not recommended. So make sure it's right for you. So there's many reasons why I love the Sunlighten, and if you go to learntrohealth.com and type Sunlighten or type sauna into the search bar, you'll find several episodes where we've gone in greater detail about why I love Sunlighten. But I wanted to let you know that this Father's Day sale is going on right now, and it's such a perfect gift to give to your whole family, but especially give to your father or your husband for Father's Day. The smallest wooden system is kind of like a foam booth. It looks quite small on the outside, but you can actually sit in it with your spouse. My husband and I can sit in it comfortably, and then our 5-year-old comes running in sometimes, and he likes to be in there for a few minutes, and it's safe for a few minutes for children to be in there. Typically, it's 1 minute for every year of age. So he gets to be in there for about 5 minutes, and then he jumps out. But my husband and I can sit in there comfortably together, and it fits in the corner of one of our rooms. So it's something that you can get the wooden system, but if you don't have a lot of space, you get the solo system. And the solo system is ultra low EMF and non-toxic. It's very comfortable to lie on, and then you wipe it up and put it away in the closet when you're not using it. So that's very exciting that you have those two options. And then of course they have larger systems, and they have different kinds of wood depending on, I got the cedar because I love the smell of cedar, but if you have, if are hypersensitive to smell, they have different types of wood depending on that. So give them a call. Just Google Sunlighten, give them a call, and mention Learn True Health with Ashley James, and they will give you that discount. They know that this discount is for you guys, the Learn True Health listeners, and they're more than happy to answer your questions. It's a wonderful company that's based in the United States, and I just really, really love the quality of their products and their customer care. If you have any questions for me about my experience with them, I've been working with them and using their system for about 2 years now, you can always reach out to me on Facebook, or you can email me, ashley@learntruehealth.com. So stay tuned for the other Father's Day sales that I'm going to be letting you guys know about. Medterra CBD, which is my favorite CBD company, because of their quality of their CBD, and I've had them on the show twice to talk about that. And then of course my favorite magnesium soak, and there's going to be others that I will be letting you guys know about. I'm going to let you know about it in the intros of the next few episodes, but I'll also be letting you know more details in the Learn True Health Facebook group. So go ahead and join the Facebook group by going to Facebook and searching Learn True Health, or you can go to learntruehealth.com/group, and that'll take you straight to the Facebook group. Thank you so much for being a listener. I'm so excited that you get to learn more about how you can reverse and prevent kidney disease, and that includes kidney stones, and that includes even if you have scar tissue in the kidneys, we talk about how to reverse that, which is really exciting. Please share this episode with those you love, especially those you know who have high blood pressure, have diabetes. These are conditions that harm the kidneys and that could lead to kidney disease later on. We really want to do everything we can to support our kidney health as much as possible. If you're healthy now, let's stay healthy. And if you have some health problems now, if you have symptoms now, let's get you back on the road to health. Have yourself a fantastic rest of your day and enjoy today's interview. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 434. I am so excited for today's guest. We have Dr. Devin Miles on the show, who is a naturopathic physician that specializes in gastrointestinal disorders and kidney disease. I'm really excited actually to talk about kidney disease today. Out of the 400 and something episodes we've had, we've never done a whole episode on kidney health, and that's something I've been really excited to discuss. So I'm very excited to have you on the show today. So many people are on dialysis needlessly that we could support everyone's kidneys now to prevent dialysis. And even I have heard naturopaths help people get so healthy that they no longer needed dialysis. So I'm very excited to have you on the show. Welcome.
Thank you. Good to be here.
This is going to be a lot of fun. Before we jump into kidney health and how to reverse kidney stones and prevent them and all the different kinds of kidney disease that we can reverse and prevent, I'd like to get to know you a little bit. What happened in your life that made you want to become a naturopathic physician?
So I started having digestive issues in my senior year of college. I was 21 years old. For me, it was just out the blue. I had not had any digestive issues. Just one day I noticed below, like my lower abdomen was just bloated. And then I had constipation, and then I had more constipation and more bloating and more gas. And then it was foul gas. And then I started noticing I was having food sensitivities that I never had before, and blah, blah, blah. And so fast forward, I was diagnosed with irritable bowel syndrome. And there wasn't much of a resolution in terms of cure or even understanding what it was. And I was introduced to this health food store in my neighborhood at the time and told the guy what I got diagnosed with, and he had had the same thing. And so he was the first person that really gave me hope about what to do about it. So that I just delved into it really started as trying to figure out things for me. And then I started to realize that I was way more into researching about health than I was my job at the time. And I was like, okay, I think I want to make a career out of this. And eventually I found naturopathic medicine. And that's when I was like, yeah, that's it. That's what I'm going to do. And then I went for it.
I love it. You just dove right in and I never looked back.
Yeah. I mean, my body spoke to me in such a way that I had to listen. It was too much. And when I found out about naturopathic medicine, it was from a book that my parents gave me that they were reading at the time. And that was significant because that was the first book, probably since the first grade, that I wanted to come home and read every evening. Outside of that, I was not somebody who read for leisure. My only time of reading was for educational and work purposes. Like that was more than enough. So the fact that I actually wanted to come home and read that book every night, that really spoke to me.
That's so cool. I know exactly what you mean. I've got one right here I can't put down. It's called The Encyclopedia of Healing Juices. And it does not sound like a book you'd read like a novel, but it does. And I can't put it down. It's like, when, like you said, when your body speaks to you and when you're really into health, when you're really on the right path, everything feels like everything aligns. And I just love that you couldn't put that book down. What was the book?
It was called 21 Pounds in 21 Days. And that was written by Ronnie DeLuce. She is actually on Martha's Vineyard, and she has her own retreat up there, which actually does incorporate a lot of juicing. So Yeah, she's a naturopath as well.
I imagine her program isn't about just losing weight, but about losing the inflammation.
Yeah, yeah. I mean, it really can apply to everyone. My mom picked it up, of course, because she was trying to lose weight, but Dr. DeLuce sees, people from all walks of life. It's not just weight loss.
Very cool.
Hmm.
So, as you went to the Southwest College of Naturopathic Medicine, uh,
Hmm.
what 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 times blew your mind? Like, as you're going through it, did you have these aha moments like, oh my gosh, I couldn't believe that we can reverse this disease or we can reverse this? And, because we're raised to believe if our family traditionally went to an MD and were given drugs, and we saw our family members given drugs for diseases and told that they're just going to have them for the rest of their life, and that's just the way it is, and we've watched the Hollywood and mainstream media and we're told this is just the way it is, and then you go to an naturopathic school and you realize, my gosh, we can reverse these diseases naturally. Like, did you have any of those aha moments?
I'm guessing that whatever I read prior to going in school made me walk into school with the expectation that I would find out how to reverse those. So it wasn't so much an aha. I think reading Dr. Ronnie's book and going to see her and talking with her, that was very pivotal for me to
Mm-hmm.
believing that I could probably find the solution to anything. So yeah, it was more so an expectation. But I will say the first quarter of school was very majestic for me. I was very much like, ooh, wow, type of thing. It wasn't an aha moment, but I was just enjoying what I was learning that first quarter.
Can you share with us something that you just really, really, really enjoyed learning in naturopathic school?
I feel like the philosophy of naturopathic medicine, because that's what I feel like that first quarter, we went into that quite a bit. Um, so just understanding how the body works, and how connected it is, I really started to harness um, that mindset when I was in school. And I realized that what we have is we're trained to have a certain mindset that is understanding that the body is connected, that it works as a whole, but it's not a rigid framework. And I recently was quoted by the Institute of Natural Medicine about that I have what I consider an open-minded framework. So there's some structure, but there's a way for you to be open to other things that you may learn that could also be pieces of the puzzle. And I think it helps you to know where to put those pieces. First, you can accept them, and then secondly, you can figure out where to put them in the puzzle that you have already like started to create. So, like for instance, with carpal tunnel syndrome, I remember learning that I think it was vitamin B6 was helpful for that. And then there was something within acupuncture that was also really helpful for carpal tunnel. And I linked those two things together in such a way that I understood why both of them worked for carpal tunnel, because I knew one and then I could put in the other one after that. So just being able to link things like that, and be open to how it works and that it does work, I think is what's been really, really nice.
Awesome. I also know that there's certain minerals that when we're deficient in can exacerbate carpal tunnel, and can
Hmm.
help when we supplement with certain trace minerals, can
Hmm.
and can help to alleviate. I've seen that before. So the fact that you're
Hmm.
not closed off, you're like, this is the only way. What's the
Hmm.
difference in terms of philosophy? Because this is really the key. The key to healing our bodies is our mindset about what direction we're going to take when it comes to our health protocol. What's the difference between seeing an MD, a medical doctor, and seeing an ND, a naturopathic doctor? What's the difference in the philosophy of healing?
Hmm. So medical doctors, MDs, have a standard of care that is, I think, quite rigid. Quite, it's more rigid. It's more strict than a naturopathic doctor. Naturopathic doctors have standards, but as I mentioned before, they have a framework that they can really build upon and branch out from. And it allows them to be more receptive to learning new things, in my opinion. And then there's more tools in our toolkit for addressing different things. So when you go to a naturopathic doctor, if you go to one and then another, you might notice that they use different approaches to get to the same result. And that's really why I think naturopathic medicine came about, is because this guy is a German guy named Benedict Loos, who put all of these pre-existing therapies together because he saw the synergy of them being put together. So, in other words, these therapies were around because he saw that they were effective, but they may not always be effective by themselves. And different people need different things. So I think naturopathic medicine allows you to have a broader framework from which to choose what is going to work for that person. It helps you to figure them out better. And we use things that are, the body better understands them. We as human beings are of nature. And so when we use things that are from nature, the body understands that better because it works with it. Versus if it's something synthetic, the body knows it's synthetic, and the body is probably missing something that it needs for that to fully work. So, like, when we use things in naturopathic medicine, we're helping to resolve the issue versus forcing one piece of it to just work better. So, for instance, if it's hypertension, if I put somebody on hypertensive medication, yeah, their blood pressure would probably come down, right? But if you take that person off of blood pressure medication, the blood pressure is going to go right back up. Versus if you adopt a lifestyle that is conducive to reducing hypertension and you use different herbs and homeopathy and some other nutrients that can keep the blood pressure down. The body is very understanding of that, and it's getting what it needs to keep the blood pressure low. And so you could say, well, if you get off of all those things, of course, the blood pressure come back too. But yeah, so that can be true. But the reality is, the difference is that your body has what it needs to be in balance. So it's not that the drug is restoring total balance to your body. It's balancing you just for the sake of your blood pressure. But is your whole body in balance? Probably not. And so that is the difference when we're working with somebody, when we're working with a naturopathic doctor. It's not just about your blood pressure. It's also about getting your whole body in balance. So if you come to me with one condition, you probably have like 8 other symptoms that you may or may not be telling me that you might notice go away when you start to work with me, because I work on the body as a whole.
I love how you put that, restoring total balance. Using the example of high blood pressure, the body is speaking to us in symptoms. This is how so many naturopaths who've come on the show have said that we need to listen to the language of the body, and the body is speaking in symptoms. And if someone has high blood pressure and they just take a medication for it, it's kind of like if your car was making a really loud noise, like maybe a belt is about to go or something, and your mechanic gives you earplugs. You're like, here, this is going to stop the noise. You put these earplugs in, and you're not going to hear that noise. And the car is still going to break down. And I believe there's statistics, and maybe you could speak to this, but there's statistic that for people who are on high blood pressure medication long term, they have shorter lifespans. They all cause mortality for those on high blood pressure meds will not live as long as those who figure out how to naturally support the body's ability to heal itself and maintain optimal blood pressure. The
I was going to say, I think that applies to a lot of different medications,
Yeah.
even outside of blood pressure.
Right. Well, if we're using now, there's certain medications. We always have to say this, right? Certain
Yeah.
medications save people's lives. Certain medications are really necessary. And I've even talked to naturopaths who say they would prescribe blood pressure medication in the short term while they're
Hmm.
helping the person to make lifestyle changes and nutrient changes and figure out like more in depth. My husband had out of control high blood pressure a few years
Hmm.
ago, and we figured out, and he'd always kind of had borderline high blood pressure, but then it went through the roof, and we figured out it was, and this is going to lead into the kidney issues. We had done the ketogenic diet under a
Mm.
naturopath's care for
Hmm.
3 months, and after that, we did blood work, and my liver was very damaged, and it
Mm.
took me years to recover, and my husband's kidneys were incredibly damaged. We had to
Mm.
do several tests and to find out. And so as a result, we ended up going whole food plant based and focusing on herbs and supplements to support his kidneys. And
Hmm.
he was temporarily put on two blood pressure medications. Or well, it was
Hmm.
a water pill and a blood pressure medication.
Hmm.
And in order just to bring it down, but it only brought it down like 8, 9 points, right? And
Hmm.
then the naturopath worked with him, and at that time we were seeing one that specialized in uh, cardiology. Very interesting guy,
Hmm.
and he figured out that my husband kind of just runs a bit kind of in stress mode. He's kind of always stressed
Yeah.
out. And so he
Yeah.
had him on cartitone, and that immediately dropped his blood pressure, which is really interesting. But then by that time his kidneys were healed. He got off of his blood pressure meds very quickly. And then everything's good now. His blood pressure's totally fine. And
Good.
so
Good.
but it's interesting though, if he gets stressed out or starts worrying about something, he can raise his blood pressure. So for him it's,
Hmm.
even though yes, he has to eat a healthy diet that's
Hmm.
conducive to kidney health and heart health. He also has to. It's just as important as his diet to maintain, like to lower his stress levels and to do that internal work to not work himself up. And so it's interesting to see if we had gone to just an MD, the MD would have just put him on meds.
Hmm. Hmm.
Whereas the naturopaths we went to addressed his stress levels, his lifestyle, his emotional, mental health, his sleep, his energy, his kidney health, his heart health,
Hmm.
his diet, right? There's so many more facets of his life have been enriched by naturopathic care than
Hmm.
an MD would have. Now MDs have their place, they're one piece of the pie of medicine, but they're not the whole pie. And in the mainstream medical or the mainstream media, we're taught that MDs are the whole pie, that allopathic medicine is the whole pie, and everything else
Hmm.
is sort of like this alternative dessert.
Right.
Where
Dessert.
it's not the case, right? It's not the case. It's just
Hmm.
one naturopath that I've worked with he calls it allopathic reductionism, and he says that
Hmm.
the MDs are trained in a philosophy of reductionistic thinking. So they're going
Hmm.
to, if you come to them with a kidney problem, right, they're just going to look at the kidneys and focus down on that, reduce it to that, and not look at all the other symptoms of the body. Whereas a naturopath, like you said, you're looking at all the other symptoms. And so when you're supporting someone in that vitamin deficiency they might have had for their carpal tunnel, you're actually supporting them in their sleep and their energy and their mood and their stress, and you're supporting them in all those other areas of their life, because a mineral or a nutrient or a vitamin deficiency will create hundreds of potential symptoms, and you're not
Hmm.
treating a symptom, you're treating the body as a whole and what the body needed. So I feel like naturopathic medicine should be the main medicine that we go to, and we should go to MDs for emergency medicine because that's where they shine, and go
Hmm.
to naturopaths for prevention and for chronic illness because that's where you guys shine.
Right. And I am in full agreement with you that, yeah, sometimes medications are helpful. And sometimes naturopathic medicine and conventional medicine do need to get used at the same time. And then sometimes for some people, it also depends on their stage of life, what they know, what they're exposed to, what answers they have. And so that's also why I like to um, be on different media platforms, and so that I can expose people to what is out there, to what is possible. And I know what it feels like to be on a journey of knowledge. And so you're doing the best that you can at each point. And so like there was one guy when I was in clinical rotations who had schizophrenia, and he was better managed, not just on his medications, but on medications plus acupuncture. That is what finally got him to a much more stable space. So, and then even with my clients, a lot of them, and I would say maybe like half of them are probably, yeah, about half are on medications. I don't tend to touch the medications. And then on top of that, I am in a state where, you know, I mean, there's about 22 states that are licensed where naturopathic physicians can practice medicine. I'm in a state that is not that. It's pre-licensed, and so I definitely don't touch their medications. But I tell them that, you know, especially if it's something like blood pressure, you need to be taking your blood pressure every day, and being mindful of that. What I'm doing may drop your blood pressure further. So we have to be mindful of episodes of, you know, hypotension, because you can get symptomatic, of course, if you have hypotension. And so these are times when you need to start going back to your physician to be like, hey, can we reduce the dose? So the, you know, the goal, of course, is for you to eventually not need the medication, right? But, you know, everybody's in their own path, and they got to find what works for them and what keeps them stable, and all of that. So I respect that.
You know, that's actually progress, because when I first got into working with naturopathic doctors, I was being mentored by naturopaths as a health coach back in 2011.
Mm-hmm.
It's only 17 states were licensed, and I know that
Oh, okay.
naturopaths have been fighting for being able to be licensed in other states. So that's great. That's progress to go from
Yeah.
17 to 22 in the last few years. That's great. I'd like
Mm-hmm.
to see obviously all 50 states. I'd like to see all the provinces of Canada. I'd like to see, you know, every country in the world recognize naturopathic medicine. And it's, you know, it's going to be one state at a time. And so the fact that there are 22 states that recognize naturopathic physicians as doctors that can prescribe drugs and are at the same level and be able to be you can use insurance with naturopaths
Mm-hmm.
for those states. It's good. It's growing. That's what
Yeah.
we want. Yeah, absolutely.
Yeah. And I enjoy what I do here I'm in Texas right now. And so Austin, of course, is a city that is very I think much more receptive. That's where most of the naturopathic doctors are. I am in Houston at the moment. So it's a different dynamic, but I enjoy when I get to educate people. And I
Mm-hmm.
think, you know, when I first got here, most people were like, "What? What's the word again? Naturopath? What?" And I feel like now, for whatever reason, they not as many people are responding in that way. They're like, "Oh, okay, okay, cool," you know,
Nice.
like that. Yeah, so it's good.
Very cool. Back in 2011, I started working with a naturopathic doctor, and he was training me. And one of my friends, who was in his early 30s, had kidney stones, chronic. He would, for 5 months straight, was urinating kidney stones, passing kidney stones. And for a man, that's more painful for a woman, just because they have a longer urethra. And so he was in agony. He couldn't leave his house. He said the only thing that helped was to sit in the shower with the hot water beating down on him. And that's just what he
Hmm.
did all day for 5 months. And so I called him up and I said, hey, I'm working with this naturopath. He has a protocol for kidney stones. And my friend said, sign me up. He got on these supplements, specifically very bioavailable minerals, including calcium, bioavailable calcium. And his kidney stones immediately stopped, and they have not come
Awesome.
back. And
Hmm.
so the naturopath that I worked with explained that, and of course there's different kinds of kidney stones, and you're going to go into this today, that there's not just one kind, but that
Hmm.
this naturopath, who's actually he's 80 years old now and he's still practicing. He's really cool. I just had him on the show, Dr. Joel Wallach. He said
Oh,
that
okay.
when we are deficient in calcium in our diet, our parathyroid glands, which are the four little dots in the thyroid. The parathyroid glands will continue to release this hormone, telling our bones to release minerals and like calcium to the
Mm-hmm.
soft tissue. And over time, those will just kind of do too much because we're not getting enough from our diet, and then it would collect in the kidneys. And so by
Mm-hmm.
supplementing with a bioavailable calcium that has all the other cofactors, all the
Mm-hmm.
other mineral cofactors, that then the parathyroid gland stops doing that,
Mm-hmm.
and then that supplementation satisfies the soft tissue, the calcium and all the minerals the soft tissue needs, and then the kidneys stop creating those stones. And I know this is very simplified. What I've said is very simplified. I'm sure he has a more medical explanation. Well, it worked. My friend never had kidney stones again, and I've since heard many other stories of people who have had the same result. But if you go to an MD, if my friend had gone to an MD at the time, the MD might have checked his calcium levels in his blood, seen that it was high, and would have told him to stop eating things that contain calcium because he
Mm-hmm.
has too much calcium. The MD sees it in under the reductionistic lens and says you have too much calcium, not looking at the whole picture. Whereas the naturopath understands the whole picture and would say, no, you actually need more calcium.
Mm-hmm.
And so there's a big difference there. If he had gone to an MD, might have gone on drugs and surgery, whereas the body was crying out for a balance of nutrients, and that's what it
Mm-hmm.
needed.
Mm-hmm.
Have you experienced that? Have you been able to? You've had great success with reversing kidney stones, but I'd love for you to dive in and explain the different kinds of kidney stones and
Mm-hmm.
speak maybe about my experience with my friend and his kidney stones that were actually a mineral deficiency.
Mm-hmm. Well, I haven't seen that particular story, but it brings to mind something that I have seen in a different form. So this is, I won't go too in depth because we're talking about kidneys and not digestive issues, but um, the theme of deficiency and overcompensation due to deficiency. I've seen that in different walks of life, in different behaviors, and so that's the theme that I pick up from that if you have a deficiency of calcium and then the parathyroid just oversupplies calcium because of that. So, but in terms of yeah, I would love to get into the kidney stones and talk a little bit more about some of the different types. And so it sounds like that might have been yeah, of course, coming from too much calcium in the body. So uh, from the parathyroid. So in terms of the kidneys themselves, so what I wanted to talk about what a kidney stone feels like first. You talked about it a little bit, but I wanted to mention that a kidney stone is going to feel like back or loin pain radiating down into the groin or the thigh, and it's excruciating pain. Um, so you would probably know that it was a kidney stone because it's that type of picture that goes with it. You can also have blood in the urine as well as an urgency to urinate. And so the way that this can be discovered is through an ultrasound. So I was your story that you mentioned before about the guy that was dealing with it for 5 months. Anyone who's listening, I would definitely urge not to wait that long. You can have, I mean, I'm glad he didn't have complications from it, but you can definitely have complications from having a kidney stone. I mean, you can definitely have like a blockage of urine, and that could, of course, go further up and cause problems. And so, anyone who is listening and is thinking that they may, in fact, have a kidney stone, please go get that checked out right away. Um, so, some risk factors for having kidney stones. Um, there could be a bone disease, as you mentioned with the one guy, hyperparathyroidism. There could be hypercalcinuria, so that's of course like too much calcium in the urine. You could have too much cysteine in the urine. There could be some sort of low-grade infection, and I'll talk about that in a little bit. There could be some abnormalities in terms of the structure of your body that creates poor urine flow. And then there could be different components that are in the urine that are in larger amounts than that they should be. So it creates a supersaturated urine, and that can form crystals, and that can form kidney stones. So a couple ways that this might happen could be changes in your urinary pH. If you have acidic urine, and we'll talk about that more, that could be a reason why you create kidney stones. Decreased urine volume. So this is why if you are prone to having kidney stones, you want to drink a lot of water on a daily basis to keep the urine from getting too saturated to where it would form crystals. So, if you think about salt, for instance, right? If you put a lot of water in the salt and you stir it up, it dissolves. But if you only put like a few drops of water in the salt, it's going to mainly just stay crystallized, right? And so that's, I think, a good analogy for understanding why you need water to keep things dissolved and so that they can pass instead of forming a crystal. So if you only put like a few drops in that salt, you can easily make a clump of salt because you don't have enough water. So bacteria could also form it, inflammation or scarring within the urinary system. Another risk factor is being elderly, being sedentary. So sedentary, of course, can apply to any age. It's not just the elderly. Cadmium exposure. And one of the top reasons someone might be exposed to cadmium is through smoking. High intake of alcohol, oral contraceptive, and then long-term use of diuretics. And diuretics is any substance that can make you have to go to the bathroom more. So some of those some medications are considered diuretics, especially if you just have a lot of water on your body that's not supposed to be there. A diuretic is what would be used to get the water off. And then, of course, going back to hypertension, some of those are, in fact, diuretics too. Not all of them, but certain classes are diuretic medications. So calcium oxalate stone contributors. So this is one type of kidney stone, is calcium oxalate. This is the one that I think is more well known by the public is calcium oxalate stones. So that can come from when your body is in a state of hypercalcemia. So there's a lot of calcium in the blood. So this could be from a bone disease, as well as sarcoidosis, tuberculosis, and then primary enteric. It's called primary/enteric hyperoxaluria secondary to bone disease. So because of the bone disease, you can have too much oxalates within the body, and when they say enteric, they're talking about the intestine. It could also be high calcium in the urine without high calcium in the blood. So this could be a hyperabsorption, so too much absorption of calcium happening in the intestines. And there could also just be renal, there's a compromise in the amount of calcium that the kidneys absorb. So your kidneys are filters, and they're also reabsorbers of certain things at different processes along their functioning. And so there could be an issue in terms of how the calcium gets reabsorbed. Also increased uric acid excretion. So the uric acid crystals themselves, from that can form different calcium oxalate compounds. And that can happen within what's called the collecting ducts of the kidneys. There could also be more oxalates in the urine. So this could either be genetic or caused by enteric or intestinal diseases resulting from intestinal overabsorption of oxalate. So this gets into that there is in fact a link between the gastrointestinal system and how well your kidneys function. And I think sometimes this can be missed, again, when you're only looking at the reductionism factor. So there's a particular test that I run on my clients with digestive issues, and it's a urine metabolite test. So within that test, you may see that you have a high oxalate count. It doesn't mean that you have kidney stones, but there's something about your body that is producing a very, very high oxalate count. And so in that case, it can be important to address that then, before you even have like something like an oxalate kidney stone. So actually, I've noticed that people with autism can also have very high oxalate counts. So hypocitrulluria is also a cause, and that can come from chronic diarrhea as well, and that's considered idiopathic. And so again, it's even in that state, I would wonder why you're having, for me as someone who focuses on digestive health, I've had clients come to me with chronic diarrhea, and that will be also in the setting of bloating and food sensitivities and all of that. And when we work on those things, the diarrhea can slow down and they can have better formed stools. So I'll probably say this later, but I'll say it also now. One of the things that I hope that you're picking up as you're listening is the fact that it is important to figure out why you are in fact forming kidney stones. Just as like Dr. Wallach did with the guy that you mentioned, he figured out it had to do with the deficiency of calcium, and it was causing the hypoparathyroidism. You have to figure out why you have to figure out what type of stone it is, and then why you're creating that stone to be able to get to a solution that works for that person. So on to the next type of stone is the uric acid stones. So that essentially, kind of going back to what I said before with the crystals, it's because you have high uric acid in the blood, and that can prosper, of course, in acidic urine. And then lastly, there are other ones, but I just kind of wanted to focus on a couple, and cystine stones. And this is more genetic, and it also forms in acidic urine. The first client I had with kidney disease, he has cystine kidney stones, and that's actually a more rare type. Most people are, as I mentioned before, have the oxalate type of kidney stones. So for cystine kidney stones, what can be really helpful is alkalinizing the urine, but we'll go into that as well. So in general, when you're dealing with kidney stones, the pain treatments that are usually prescribed by physicians in terms of medication would be antispasmodics. So that is designed to help keep you from spasming. So when a kidney stone is in there, you want to try to loosen up everything so that it will be able to pass better. So the antispasmodics can be helpful in that regard. And hemostatics is another type of medication that's designed to help stop blood. A hot soak bath, kind of as you mentioned with your friend, is that the hot soak baths may be also helpful for pain. But a few other things to keep in mind, kind of going the more naturopathic route, and, is to reduce large amounts of meat. If you're having a lot of meat in it can create a very acidic environment. If you're having way too much of it, it can cause a lot of problems, and it's not the best thing for your kidneys. Especially if you already are having kidney disease. That is a very common thing for me to tell someone is you definitely need to reduce your protein, and particularly animal protein can be in large amounts can be quite damaging for kidneys, not just from the degree of if they were already if they were already damaged, it's even more important for you to reduce it. But if they're not damaged, you want to only have a moderate amount. It can't be just like meat all day long.
It also depends on the type of meat. So Dr. Wallach was a pathologist he was given diseased kidneys after they were removed for patients who had kidney transplants. And he looked at the kidneys and said, "Why did you send me the healthy kidney?" And the doctor said, "What are you talking about? I removed the diseased kidney." And he said, "There's nothing, I can't find anything wrong with this." So he ended up getting the strongest microscope he could and looking at the nephrons of the kidney. And what he figured out was that the kidneys were being clogged by nitrates and nitrites, that these preservatives that are in deli meats and smoked meats the molecules are large enough that they actually clog the kidneys, the nephrons in the kidneys. I mean, the kidneys are kind of similar to the eyes in that they're incredibly vascular. And
Right.
So kidneys and eyes are the first to go. Like if we have a vascular breakdown, right? People will
Mm-hmm.
lose their eyesight, like they'll start losing their night vision, or they'll need stronger glasses. Um, and same with the kidneys, because
Mm-hmm.
they're very vascular, and
Mm-hmm.
so vascular that only one blood cell can pass through at a time. Like that's how narrow it is. And
Mm-hmm.
if those passageways are inflamed or damaged by certain chemicals like sodium nitrite, potassium nitrate, or however it's said, it's the nitrates and the nitrites. If
Mm-hmm.
you eat bacon, the bacon's the most common example, but hot dogs and any kind of smoked meat, uh,
Mm-hmm.
that Dr. Wallach found will absolutely over time not only damage the eyes, but will damage the kidneys and damage the vasculature in the body, where the capillaries are so thin, right? That
Yeah.
only like one blood cells pass through at a time. That's where the nitrates and the nitrites do their damage to us,
Mm-hmm.
and that they're not needed for preserving meat. They actually just prevent meat from looking gray. So
Mm-hmm.
it's like when someone goes to buy hot dog or bacon, if they see the hot dog's gray, we think, oh, it's gone bad. Well, that's actually what meat normally looks like if it's sitting there for a few days, or if it hasn't
Mm-hmm.
been frozen. But
Mm-hmm.
so many meats have been preserved with these chemicals that are harmful for the body to make them look appetizing.
Yeah.
So that's what Dr. Wallach does. The first thing he does when someone has kidney disease, he gets them off of no. He says no nitrates or nitrites, no fried food at all. 100% remove fried food, and there's about 12 foods that he removes from the diet that cause damage to the vasculature of not only the kidneys but the whole body, but it's most
Okay.
important in the kidneys because of the concentration of vasculature. um
Mm-hmm.
and then he focuses on high amounts of antioxidants,
Yes.
and then he gets them on certain nutrients to make sure that they get the 90 essential nutrients, all vitamins, minerals, amino acids, and fatty acids.
Mm-hmm.
That's his protocol, no matter what kind of kidney stone the person has, no matter what kind of kidney disease, because he's looking at supporting the kidney health overall. And
Mm-hmm.
it's very interesting when you start to see how an experienced naturopath treats someone's kidney disease versus how an experienced medical doctor would treat someone's kidney disease, because the medical doctor is not trained to heal the person to the point where they no longer need medication.
Right.
The medical doctor is trained to manage someone's disease state, manage
Mm-hmm.
them, and, make them comfortable, obviously make sure they don't die, get them on dialysis, that
Mm-hmm.
kind of thing. But a
Mm-hmm.
naturopath's goal is to get them to the point where they're disease free.
Mm-hmm.
It's a totally different philosophy. So
Yeah.
it's very interesting. I like that you brought up, alkalizing the body, drinking plenty of water.
Mm-hmm.
For these, depending on which kind of kidney stone or kidney disease, they're going to see more benefit. But in general, wouldn't everyone across the board, wouldn't all kidneys benefit from a more alkalized um, urine or alkalized diet, and a
Mm-hmm.
more and drinking enough water? Or is there a time when a kidney wouldn't benefit from that?
No, I think in general the body does better when it's I wouldn't say just so far alkaline. I mean, like at one point I saw alkaline urine, but the person was still having a lot of problems. And so I wouldn't use the urine as a marker to say everything's good because my urine is alkaline.
Right, right.
Like there's other things that can be out of balance. And it depends on kind of, like what the person is dealing with. But yes, in general, if you stay in a more alkalinized way of life compared to what the standard American diet is, yeah, you're bound to see some improvements in your health, because the standard American diet is very, very acidic. And so that's why this push into a more alkaline diet can bring you back to the balance that you need to be at.
So we have to understand that the kidney disease or the kidney stones is actually a symptom and not the problem. Like, it is a problem,
Right.
but it's
Yeah.
not the problem. That all the symptoms we're experiencing are not the root cause.
Right.
They're the body speaking to us. The body, my body's out of balance. Something's going on. And we have to go deeper and find the root cause. And the root cause is always going to be, how do I support the body to balance itself out? Because the body
Mm-hmm.
knows how to heal itself when we remove the things that are hurting it and give it the nutrients it needs and the
Mm-hmm.
support it needs to so that it can do its own work. The body does its own healing, and we have to figure out what we're doing to hinder that healing and how
Mm-hmm.
we can support that healing. And that's why I love how flexible naturopaths are, because that's what you're looking for. How can I
Right.
support this body to heal itself?
Mm-hmm. Yeah,
Right.
and kind of going back to what you said about the nitrates and nitrites. I mean, chemical and heavy metal toxicity is a significant obstacle that needs to be removed, and um, that I think is a huge piece as to why Americans and well, I suppose Canadians as well. I can't speak to Canadians, but in general, I think why our world is getting sicker and sicker because it's in addition to, you know, I talked about with medications being synthetic, chemicals themselves are foreign to the body. They're not supposed to be there, and so when we're consuming them through our food, our water, our air, all of these things also need to be looked at. They're not too long into when I started my business, I'm on Instagram at Dr. Devin Miles, and um, a another organization reached out to me called, and they were advocating for farmers in I think it was Central America, but apparently there was something about uh, the practices that were going on down there that was giving people kidney disease. It was a chemical within the crop that they were
It
farming
was
that
probably
was,
glyphosate, which is
I,
in Roundup. In
mhm,
I'm only saying this because in Sri Lanka, they the whole country banned glyphosate, which is in Roundup. They banned
mhm,
this at the time. It was Monsanto. They banned Monsanto's Roundup
mhm,
because the farmers who are working in the paddy fields, or the rice paddy fields. So if you've ever seen rice fields, it's like a marsh, and the
mhm,
farmers are, their skin is exposed to the water, and
mhm,
before they used Roundup, they were using arsenic as a way
mhm.
to combat pests,
Yeah.
and that was working, I guess. I don't know how they didn't have arsenic poisoning, but that was working. And then they used glyphosate, and the problem with glyphosate is that it's a chelator. It binds to certain heavy metals, and then it will release them when pH changes in the body. And when pH changes in the body, it's when fluids change from one to another. So blood to cerebrospinal fluid, blood to urine. And that's why all of a sudden all farmers in Sri Lanka developed kidney disease, because
Mm,
the
mhm,
glyphosate, which had bound to I believe it was arsenic, but had bound to the heavy metals in the water, and then was
mhm,
releasing them quickly into the kidneys. and
mhm.
and they were all I mean, if you can imagine running a country and all of your farmers who are working in the rice fields become sick,
Right.
you want to take action. And so luckily they detected it was that, and they got rid of it. Unfortunately, Monsanto, or now Bayer's, been pressuring the country to let them use it again. So I don't know where that stands. But that's the problem
Mhm,
with glyphosate, is that and I'm sure there's other ones, but glyphosate in particular is a nasty chemical that is put
mhm,
into our crops because it is a chelator that will bind to heavy metals and then deposit them into our brain and into our kidneys.
mhm,
Kidneys more so than brain, from what I've heard.
mhm.
So I'm imagining that's what it is. But like you said, chemicals are man-made, are foreign to the body. We did not evolve for hundreds of thousands of years with these chemicals.
Right. And I would just like this to also say, when it came to these farmers, these were like 28-year-old men. So I think sometimes we look at kidney disease as something that may happen to people later, and that's not necessarily the case. So it is important to keep a diet that is conducive to kidney health, and also to be mindful of the different chemicals like the nitrates and the nitrates, um, and glyphosate, to make sure that you're avoiding those things as much as possible. And so, of course, if you can have more of an organic diet, you're going to reduce the amount of chemicals that you're exposed to, even through eating things that are per se from scratch or fresh produce. Because, of course, there's going to be higher amounts of pesticides, fungicides, all of these. There's going to be in higher amounts if you are, in fact, eating organic, non-organic produce. And I particularly tell people who like to juice, when you're juicing, juice organic because you're getting a higher amount of everything,
Mm-hmm.
the good and the bad. So just make sure when you're juicing that you are juicing organic.
Absolutely. That's
Hmm.
that's very important. And
Yeah.
even go so far as to grow your own produce and juice
Hmm.
it, or a friend or a farmer locally that you know, that you can get to know the quality of the produce.
Right.
That's awesome. Yeah. Yeah. Are
Hmm.
there any other I know we got
Oh yeah.
sidetracked. Are there you've got a list. You've got a list. Okay, let's continue on your
Yeah.
list.
So in addition to large amounts of meat, restricting alcohol, coffee, black tea. So one thing that I would say about coffee is that coffee is in fact a diuretic. And when you drink coffee, you have to make sure that you're balancing it out with even more water because coffee is going to make you lose water, right? So if you're trying to protect your kidneys and you're trying to avoid kidney stones, you have to compensate with drinking more water if you're in fact going to drink coffee. But in general, it's better to get off of having too much coffee in your life. And then again, you would have to figure out why someone's drinking. I've seen some clients drink like half a pot of coffee. That's way too much. And so helping you to get off of coffee is going to be really important for you, as well as black tea. So one of the things that can be helpful for calcium oxalate stones is magnesium. And the reason for that is because it increases what's called the solubility of it. So getting back to making sure that it does not clump and form a crystal in the urine. So magnesium helps to decrease that chance of that happening. Um, Also, potassium can do essentially the same thing. It helps to reduce the saturation of calcium oxalate, and it helps to decrease crystal formation. Stopping smoking. So, as I mentioned before, if you are a smoker, you're getting in more cadmium, and that can increase your chances of forming stones. Of course, that's easier said than done, right? But um, starting that path, this is another reason why it would be worth starting that path. Um, Reducing caffeine intake, and in general, hydrating to the point of 2 liters per day of output. Um, so that's what I mean when I'm saying drinking a lot of water. I have a lot of clients who, when they first start coming to me, they're only drinking about 2 glasses a day. So you hear everybody say, yeah, drink water, make sure you hydrate yourself. But there's a lot of people on a day-to-day basis who are not doing that. And so I would just encourage everyone, not just people who have kidney stones or kidney disease, to drink a good amount of water every day. I try to make sure people are getting in at least 8 glasses a day. It just depends on kind of what they're coming in for. But particularly for kidney stones, kidney disease, you need to be drinking a lot more water. So,
Can we stop there for a sec?
yeah.
How much is enough? I've heard drink one half of your body weight in ounces. So if you're 200 pounds, you should
Hmm.
drink 100 ounces a day.
Hmm.
And I've also heard you could drink one third of your body weight in ounces, but then add 8 ounces for every vice, like every time you're stressed out, exercise, smoke, or drink caffeine or alcohol.
Hmm.
What's your philosophy on how much water we should drink?
I usually try to get people to do half their body weight in ounces. If it's somebody who's overweight, that can be an astronomical number for them. And I just try to get them to drink as much as possible. When I say half your body weight in ounces, I find that to be um, something that has to be worked up to. So I'm always just trying to get my clients to get to that level. So yeah, I mainly just keep it at half your body weight in ounces, and I try to talk to them about the type of water that I would like them to drink. So if they have like a reverse osmosis filtration system, I'm going to suggest adding more minerals, or at the very least, adding some sea salt to the water you drink, or some lemon juice, cucumber, lime juice, to put minerals back in the water. Because when you drink just water that it's reverse osmosis. It's less nourishing to your system because water is not just something to help with solubility and increasing filtration. It's also supposed to be very nourishing to the body. It supplies some of these minerals, right? And so having something like spring water or alkaline water, or putting things in your water to increase its mineral content, is something that I do suggest. And just making sure that they're drinking half their body weight in ounces, and then at a minimum 8 glasses a day. Because most people, I mean, I'm somebody who needs about 8 glasses or so in terms of my body weight. I'm a smaller person. So when I put that rule out there, I know that that's roughly the minimum. So that's why I'm always trying to just get people even to that point.
It also depends on someone's diet. Someone who
Yeah.
eats like a carnivore diet or versus a paleo diet versus a whole food plant-based diet is getting at
Mm-hmm.
different levels of fiber. I've known people who've switched over to eating more fiber and all of a sudden they became more dehydrated because they didn't realize
Mm-hmm.
that they need to, fiber kind of binds to the moisture,
Mm-hmm.
and so you need, if you're going to start eating more fiber, eating more fruits and vegetables, nuts and seeds, and especially like chia or flax, you
Mm-hmm.
definitely want to add a lot more water to it.
Mm-hmm.
And if you don't get enough fiber, there's a whole a whole separate discussion on
Right.
the long-term damages that the body will undergo if we don't get enough fiber. And of course, not enough fiber and not enough water combined are just
Mm-hmm.
you're setting your body up for disease. So we want to increase
Mm-hmm.
fiber and increase water. And if you increase fiber, you've got to increase water even more
Mm-hmm.
so.
Yeah. Another way that some men might be able to gauge their water intake is by their ejaculation fluids. Sometimes it can be very, very clumpy if they're not drinking enough water, and other times it's more fluid if they're drinking enough. So that could be another like quick way
Wow.
to it's a quick way to kind of tell, So
That's
um
interesting. Yeah, I didn't know that. Yeah, I learned something new.
yeah. But yeah, so where was I? Yeah, so we were talking about the kidney. The other thing that I wanted to mention was some things that can be helpful for the cysteine stones, because that is more rare. As I mentioned before, alkalinizing the urine is important. I had a client who was forming kidney stones every single year for like the past 30 something years, and he had to get lithotripsies to dissolve them and break them up. So that's a procedure you would go in the office for, to get the kidney stones broken up. And he would notice that every time he would get those procedures done, his kidney function would go down. So now that he's very focused on keeping his urine alkaline, which he does test through the pH strips, through his diet, he does this. And ever since he's done that, he has significantly reduced how often he gets kidney stones. At one point, he was not getting them at all. Just recently, he had a little pinch of something, but nothing compared to what he used to get every single year. So for people with kidney stones that are cystine, just know that if you are very committed to alkalinizing the urine, you can see some results that way from preventing the formation of kidney stones. And then, of course, just restricting the amount of sodium, so that's less formation of different crystals within the body as well. So, and then I was just going to talk about a few herbs that can be helpful for kidney function as well. Is that where you'd like me to go next?
Yeah.
Okay. All right, cool. So, of course, the next step is, okay, how is your kidneys in general? So if you're somebody who's forming kidney stones a lot, there may be a propensity to do kidney damage, right? So one of the things that I implement with my clients who have high risk factors for kidney disease, and then I also implement it for clients who also have kidney disease, is herbs that can be protective of the kidneys, and also help to restore function to the kidneys. So when I said to address the cause, hypertension and diabetes are two top reasons that people might have kidney disease or get kidney disease in the United States. So just remember that in general, you have to look at the cause of the kidney disease. Kidney disease usually happens because of something else going on in the body. So, or even if it's very much kidney related, there's some sort of imbalance going on in the body that needs to be addressed. So milk thistle is an herb that's most people know about for liver, but the milk thistle is also very beneficial for the kidneys. So it helps to reduce blood glucose, also helps to reduce your HbA1c, as well as serum creatinine. And creatinine is a marker that you can look at to assess kidney function. It's often looked at when you get routine blood work. It could also reduce uric acid in urine volume, and it does help to regenerate the kidneys. Milk thistle itself is an antioxidant, and I do want to mention what you said about what Dr. Wallach said about increasing antioxidants. So in my studies of kidney disease, the main theme that I pulled from that was you have to reduce the inflammation and you have to improve the antioxidant status of the person's body. And inflammation can feed free radical damage. Free radical damage can feed inflammation. And so it's important to reduce the inflammation and boost the antioxidants at the same time. So milk thistle can be helpful with improving antioxidant status within the body. And then secondly would be cordyceps. So cordyceps is actually not an herb, it's more like a fungus, but it could also help to reduce blood urea nitrogen. Again, another marker that is often used to assess kidney function. Reduces creatinine and increases protein in the urine. So protein in the urine is a common sign that people look for to assess if the kidneys are damaged. So that's when I talked about kidneys being a filtration system. The kidneys are not supposed to be filtering out protein in such a way that like it would be picked up on a urinalysis. So if there's protein in the urine, there's some sort of compromise going on with the kidneys. So cordyceps also just overall improves the immune system. It can help with improvement in anemia and also is good for kidney regeneration. So when we talk about kidney regeneration, I highlight that on purpose because in conventional medicine, there's not that idea that the kidneys can regenerate themselves is non-existent. The liver is very well known to regenerate. It has the capability to regenerate itself. In modern conventional medicine, that belief system is not there unless you're at extremely early stages of kidney disease. They may see that, oh, you're having some protein in your urine, and it may be something having to do with your blood pressure's too high, right? So if you start to correct things very quickly in that moment with an MD, you can see some reversal and get out of kidney disease, right? But if you're at kidney disease stage 3, they're not trying to tell you that we can get you, out of kidney disease. So because they have this idea that the kidneys cannot regenerate. So this is where naturopathic medicine can come in and help to start to bring back function to the kidneys. A lot of people do call me when they're at kidney disease stage 4 or stage 5, and I want to bring that to people's attention as well. I launched a free ebook for people to start to learn how to monitor their own kidney function, because it's like there's some sort of disconnect between the physician telling them, hey, you're at kidney disease stage 1, 2, 3. It's like they don't really tell them until they're at stage 4 or stage 5. And even before that, even if they know they have kidney disease, the physicians are saying things like, oh, you're fine. It's not that bad. And then around stage 4 or stage 5, they're like, hey, you're at stage 4 or stage 5. You need to be considering dialysis. And so I think that educational piece is not there. And so I find it important to put that back on the public to be like, hey, this is what you need to be looking at when you get your routine blood work. And it's only a few markers that I educate people on to look at and to look at it regularly, especially if you are at higher risk for getting kidney disease because you have something like hypertension, lupus, diabetes, so that you can bring that to your physician and be like, hey, what do we need to do about this? This is what's going on. So that's really important. Is the milk thistle can be helpful, cordyceps can be helpful. There was something else I wanted to mention, and then flaxseed can also be helpful as well. It helps to reduce the inflammation, and can be very helpful in a case of lupus nephritis. So, any other questions you have,
Yeah,
Ashley?
I've definitely heard of herbs being used to soften the kidney stones and herbs used to support the kidney function and decrease inflammation.
Mm-hmm.
And these are all tools that MDs have no training in, and of course naturopaths, this is where you guys shine. Um, what about homeopathy or other forms of therapies or therapeutic interventions to support kidneys? Have you seen homeopathy be successfully used?
Mm-hmm. I have not used homeopathy for kidney disease. I'm aware that it has been used. I just haven't used it myself yet. I've more so focused on the herbs for helping with kidney disease. So unfortunately, I can't speak too much to that, but I do know that in some cases, like homeopathic mustard seed might be helpful for kidney disease. Yeah.
Oh, interesting. Huh.
Mm-hmm.
Never.
Yeah.
That's cool.
Yeah.
Awesome. Do you have any stories of success you'd like to share?
Um, the main one is like the guy with the cystine kidney stones, as I mentioned before. When we alkalinized his urine, he stopped having kidney stones. Um, in addition to that, though, when he did start to have more of an alkalinized diet, he also was someone who was dealing with hypertension and high uric acid. He has not had to take as much hypertensive medication. Um, and I believe his uric acid also went down. And then, of course, by the time I started working with him, he was already at like stage 4 kidney disease. So I did put him on a blend of herbs, and that also included cordyceps. Another one that can be helpful is nettle seed. So we hear about nettles um, more so from the standpoint of seasonal allergies, but that is nettle's leaf. So when it comes to herbs, you have to also know what part of the herb that you need to bring about the result that you're looking for. So nettle seed is also helpful for improving the function of the kidneys. And so it was that, as well as gotu kola can also be helpful for reducing the scarring of the kidneys. And so that's something else to keep in mind, is that when the kidneys are scarred, that is another area where conventional medicine does not have a solution for. Once it's scarred, it's scarred. But with herbal medicine, you can, in fact, start to see reduction of scarring within the kidneys.
And Gotu
Uh,
Cola is not a type of soda pop.
no, no, it is not a type of
It
soda
sounds like
pop.
a delicious drink. Gotu
Yeah,
Cola.
no.
It's an herb, right?
Yes, it's
Yeah.
an herb. Cola is spelled Kola. Um, but yeah, this is an herb with multiple benefits, as most herbs are. Most herbs have multiple different things that they are capable of doing. In school, we had like a garden of herbs in the back, and some of the students would just choose some of the gotu kola leaves before they went for an exam because it can be helpful with cognitive function. Um, it's also helpful for um, situations like venous insufficiency. It's a good toner of the vessels. So when we're talking about kidney disease, of course, we're talking also about the blood vessels as well. So it may be indicated in that way as well. But I particularly use it if I am looking to help reduce the scarring of the kidneys. So that would be, I think, my main one where I saw not just the blend of herbs that I used on that client did help to increase kidney function. And it was at a point where he was very concerned about going on dialysis. This was somebody who really wanted to avoid dialysis. And so he had a commitment to staying on the herbs, sticking to his diet. And so that would be a big thing that I would tell people with kidney disease is that you have to be very, very proactive about it. Because for years, this client was not. He ate a lot of meat. He took his blood pressure medication, but at one point he wasn't taking it the way he should and all of these things. And so you just have to make sure that you're very committed to helping make sure that your body stays in balance and taking the different herbs that people are suggesting or the different minerals and being consistent with that. And then just speaking up if for some reason something is not working for you. So particularly with men, I have noticed that sometimes they will stop taking something and not tell you, oh, something about it, I didn't, I felt sick or something like that. You have to be able to voice that so that the doctor can adjust things, because there's a lot of different herbs that can be helpful for kidney disease. It's not that I'm just sticking with just one. So it's just important that you are very much communicating what you need with your doctor so that you can get to the goal of restoring kidney function.
I love it. It is possible. It's possible to support the body's ability in healing itself. Just to come at it from a different angle, my cat, who is 16 years old, has kidney disease, and I was seeing a traditional vet, and there was very little resources she had, and then I went to a holistic vet. I mean, I guess this is kind of like the naturopathic of vets. He's been a vet for over 30 years, and he uses natural medicine for animals. And I know him because a friend of mine, he reversed a disease, a chronic disease in her cat, and her cat lived to, I think, be something like 21, very healthfully. And I brought my cat to him, and he immediately found so many issues. Like he found a parasite that was actually had never seen in cats, and it's only ever seen in dogs. And he found, so we treated that, and he adjusted our cat's food and gave him a supplement, and now his kidney disease has, he said, I don't expect it to like completely go away, but I definitely expect us to like go back to like early stage. And that's what's happened, is that for our cat, who's a senior as a 16-year-old, he went from almost end stage kidney disease to very, very beginning kidney disease, and our vet believes that now he's going to live a very long and healthy life. And that's just, we are animals. Our bodies are just like animals, and if we can do that, if we can reverse and prevent disease in animals, we can do it in our own body. Bringing back up Dr. Wallach, his background is on the farm. He was raised on a farm, and he saw as a child, he asked his parents, why do we give supplements to the cows, but we don't take supplements? Why do our cows don't wait to get sick and then go to a doctor and then get put on a bunch of medication? We give them, and his farm, it wasn't like a factory farm. The cows got to go outside, get exercise, eat grass. And then we're also given supplements with, he read the ingredients and he saw, wow, there's vitamins, there's minerals in here. And they make sure that they're giving, the calves are given all these pellets with all these minerals. And he thought it was really odd that the system of medicine for animals was to prevent disease, because preventing disease is cheaper than waiting to get sick and then having to be put on medication. Can you imagine if our animals were in the same medical system as all of us, right? A burger would be $5,000 because the animal would have to wait to get sick and then be put on all these medications and have all these surgeries. And it's just, so it's kind of ridiculous, but it's because it's for profit. Because it's for profit, it benefits the farmer to make sure they prevent disease in animals. It's why isn't our focus in medicine to prevent disease in humans? Because it's for profit. So we have to remember that the funding that these universities have and have had for over 100 years are from the pharmaceutical industry, and that there's a lot going on in the background that has the system set up in a way that is for profit. I'm not saying that individual doctors are evil and looking to, looking to profit from our sickness, but that the system as a whole is set up to profit from people being sick and not profit from preventing illness. So
And oh, go ahead.
I was just gonna say, so looking at, if we can look at that, how do farmers keep healthcare costs down on the farm? Like, and I'm not, again, not saying factory farms, because those are incredibly sick and damaged animals, but
Mhm.
those, the farms where the animals roam free, what are the farmers doing to keep animals healthy and prevent disease? And why don't we adapt the exact same philosophy? Get
Mhm.
plenty, like, have access to clean water, get plenty of outdoor exercise, get really healthy, lots of plants, eat lots of plants, and also take supplements when needed to fill in those nutrient gaps. That's what farmers do to prevent disease on the farm, is make
Mhm.
sure that there's no nutrient deficiencies in the animals, and when there is, there's documented cases of disease, and that's
Mhm.
same as humans. So
Mhm.
it's very clear that the philosophy of health and medicine make a difference when it comes to seeing an naturopath versus any other kind of practitioner.
And I think just kind of an overall thing that I think our society, the way that it's built, has to face is that there were things built upon that need adjustment. And when you build something and you're not flexible in the building of it to create an environment that allows for adjustment, I think that is maybe where some of the problem lies, especially if it's lucrative in how it's built. So when I'm talking, when we're talking about the system of health is in this country is not what it should be. It's a system that was built, and you have to be able to break that down and to adjust it. And I think when people are finally willing to break it down and do it again, I think that's when you're going to really see some change.
And those that are listening right now are those who their thinking is in the right place. They want to do everything they can to support their body's ability to heal itself. They want to nutrify their body. The 37.2 trillion cells in their body are crying out to be detoxified and filled with nutrients and hydrated, and treated with love. And that's what we want to do. It's what our listeners want to do. And they've learned so much from you today. I'd love for you to give us some homework. What can I set us up with some homework that we can do every day to optimize our kidney health and prevent kidney disease?
So a few things that have been helpful for alkalinizing the urine. Uh, One of them is pomegranate juice. So making sure that you're getting a very high quality pomegranate juice is where you'll see the most benefit from that. Cantaloupe is another one. And then pinto beans, which that was like, oh, really? Pinto beans can also be another one that can be helpful for alkalinizing the urine. Getting pH strips if, in fact, you do have kidney stones or kidney disease, and regularly testing your urine to make sure that it's staying in the alkaline range. And so um, you will be able to start to notice what acidifies your urine, what makes it more alkaline, and through that process you'll be able to have a more balanced diet. So I'm not saying that you can't eat meat, right? But it needs to be most likely more moderate if you have very acidic urine. And that's the same with, of course, coffee, which is in addition to being a diuretic, it's also highly acidic. So looking at the things that cause acidity. So it's not just about knowing what alkalinizes the body, it's also about knowing what makes it acidic and having a better balance between those. So pomegranate juice, cantaloupe, and pinto beans are three foods that you can start incorporating more to achieve better alkalinity. Water, water, water. I cannot stress that enough because I really feel like most people kind of take that part for granted, like it's not that important, but it is very, very important. Um, and then just remembering that magnesium can also help increase the solubility of these different compounds that can form crystals. So magnesium can be helpful for constipation. It's also helpful for reducing muscle spasms. So when we were talking about the prescription medications that are called antispasmodics, magnesium can also help to be an antispasmodic. So the three alkalinizing foods, pomegranate juice, cantaloupe, pinto beans. Remember to drink half your body weight in ounces with water. And then keeping in mind that magnesium can be very helpful if, in fact, you have a kidney stone or if, in fact, you have constipation. So, again, remembering if you have a digestive issue, you have some sort of intestinal problem, that also needs to be addressed so that you can reduce forming different types of kidney stones.
Now, you before we hit record, you had alluded to that there's a connection between gut health, maybe the microbiome, but gut health
Mm-hmm.
and kidney
Mm-hmm.
health. Can you go into that a bit?
So if there is imbalance within the intestinal tract, sometimes you can have increased absorption of certain compounds that are like intestinal overabsorption of like oxalates. Or so when you have that happening, then the kidneys have to filter that out. So if you're putting too much in the kidneys in terms of different compounds that are conducive to forming kidney stones, again, that's another situation where the it's too much, it's too saturated. And so it's important from that standpoint in terms of understanding where this excess amount of compounds going to the kidneys is coming from. It may in fact be coming from a compromised intestinal mucosal layer. So in that case, I would be concerned about, okay, do you have good digestive health? What's your secretory IgA levels, right? Or do you have food sensitivities? Do you have gas and bloating? What's your mental health like? Because, of course, if your mental health, like if clinically something is a little bit imbalanced mentally, that could also be something simple as you need to stop eating gluten, because gluten and mental health have been very much linked. And of course, gluten and digestive issues have been very much linked. So it's also, it's about figuring out, okay, do you have a digestive component to kidney stones? Do you have a digestive component to kidney disease?
You mentioned earlier oxalates.
Mm-hmm.
How do we reduce? Should everyone monitor their oxalates and reduce them, or only those with kidney disease? Do oxalates cause kidney disease? Like, how can some people eat pounds of spinach and be totally fine, and other people, barely look at spinach and get a kidney stone?
So I think some of that could in fact be genetic. Kind of going back to maybe someone has like the deficiency of the calcium, and so they're forming calcium oxalate stones. So maybe it has more to do with the calcium versus the oxalate, right? If they have digestive issues, I do think getting tested to see if you have high oxalate amounts could be a good thing, a good idea, especially if like if kidney stones were running in your family, there's a chance that you might be more prone to making them. So no, I don't think everyone needs to be monitoring their oxalate levels, but I think people who might have conditions where there's a propensity to monitor oxalates, then yes, it would be a good idea for you to monitor them. And then, as I mentioned before, like if it's increased uric acid excretion that's forming the calcium oxalate stones, then decreasing the uric acid would be really important as well. B6 is another vitamin that can be helpful for reducing the calcium oxalates as well.
Excellent. You mentioned magnesium, and I got to say, my favorite source is Kristen Bowen. I've had her on the show a few times. She has a magnesium soak that is from the Zexine C, and it also has other cofactors in it. But you absorb 20 grams of magnesium when you soak in it for an hour. And the first time I soaked in it, I felt drunk. I actually felt like I was getting a Myers push. I felt like I was getting IV magnesium. and I couldn't believe it. So, but then I felt it in my body. I'm like, whoa, this is amazing. So if anyone's ever had like a Myers push or had like an IV magnesium, you kind of feel drunk, like you feel high, you feel very happy, you feel very relaxed.
Mm-hmm. Yeah.
And and that's exactly how I felt in my first time doing her foot. Well, she just does. It's easy just to put your feet in it and soak, but you can also soak in a whole bath. Um,
Mm-hmm.
and that was probably about 2 years ago, and I've had her on the show, and it's very interesting. She's done thousands of labs with her customers over the years, over the last, I think, 13, 14 years. And she has people test their um, magnesium RBC levels before
Mm-hmm.
starting. And then they do a 30-day challenge where they soak every day for 30 days in the magnesium. And then they test their magnesium RBC levels again. And 76% of people reach full cell saturation of 5.0, which that's not the ideal number. Like ideally you want to be like more closer to 7.
Mm-hmm.
But being at 5.0 is like, okay, good. We're out of the deficiency. We're no longer magnesium deficient. And then the other percentage just take longer, and then to take more time in soaking. And what she finds is that then when people don't, and through the skin, when you're absorbing through the skin, they're obviously bypassing any digestive issues with absorption.
Mm-hmm.
But so
Mm-hmm.
those people then they're sort of burning their magnesium faster than they can absorb, either through chronic fatigue, or there's other things going on that their body's sort of using up more magnesium than it can take in. And it just takes them longer to soak in it to get to full cell saturation. So it helps them to understand underlying issues. But that's been my favorite source of magnesium, and if you want, I'll send you some information on it. I've
Yeah, it'd be
had
good.
yeah, I've had over 2,000 listeners use her magnesium soak and absolutely love it. And many of them have shared in the Learn True Health Facebook group their
Mm-hmm.
experiences with it, that it's been life changing.
Mm-hmm.
My whole family, including our son, loves it, and it really helped him with his sleep, because we had a really hard time getting him to sleep until he started soaking and putting the magnesium in his bath. And then he now goes to sleep much easier, which is great. Any parent who struggles with a child that won't go to sleep, it's like a lifesaver.
Mm-hmm.
But yeah, that magnesium can be found it's a magnesium soak, and it can be found at livingthegoodlifenaturally.com, and then use coupon code LTH for the listener discount. That's I know it's like the world's longest URL, but livingthegoodlifenaturally.com.
That's good.
Yeah, coupon code
Mm-hmm.
LTH. Your website is easy to remember. However, it's Dr. Devin Miles, drdevinmiles.com. And of course, the links to everything you do, your Twitter, your Instagram, your Facebook, your YouTube, it's all going to be in the show notes of today's podcast at learntruehealth.com. It's been great talking to you about kidney health. Everything that you talked about in terms of supporting kidneys would support the whole body. Like drinking more water supports the whole body, focusing on making sure digestion is optimal, making sure we've got the right vitamins, the right minerals, making sure that we're, adjusting the diet to include more plants, more fiber, taking some herbs that not only support the kidneys but support other functions of the body. Um, is there anything about, like, in terms of taking those herbs, I would hate for someone to take too much of it. Is there a dosage, or like a way? Would you rather have them take it as a tea or a tincture or a dried herb in a capsule? Could you
Oh,
get into
that's
that?
that's varied per person, to be honest. I mean, there's definitely such a thing as too much of an herb. So when it comes to dosages, it really is dependent. So like kind of what you were saying before with people with digestive issues, they sometimes may need more, sometimes they may need less. So it really does depend. Like when you were talking about the magnesium, one thing that can be helpful for people with digestive issues is instead of like a tablet, having more of a capsule or a powder or a liquid, so much further with them versus something that's like one more thing that's hard for them to digest, because the powder or the liquids are going to get into their system much quicker. Um, but when it comes to kidney disease, usually what I try to do is the tinctures, which is a liquid, so that it can get into their system much quicker. And then I could better, it's, especially when you're doing formula, herbal combinations, and you're doing like, at least 5 herbs, um, doing it in a liquid form is going to be much easier for them to take versus, 5 different capsules of herbs. It just depends on the person though, because I could say that and then they may be like, no, I'd rather capsules. So it's also about listening to the person and what they need. But yeah, in terms of dosages, it really just depends on the person.
Got it. It's best to work with a naturopathic physician who's experienced in working with, supporting the kidneys, right?
Yes.
Yeah.
Yes. Yeah.
Like
Because I
yourself.
mean, yes. Because I mean, it brings to light the hope that things can change. We're more educated in this realm of possibilities that yes, these things can in fact help your kidneys. You don't have to just wait until dialysis happens. You can be doing something in the interim to support kidney health. And I think that's one thing that I'm always trying to help people to understand is that what I do is empowering. Like I'm not just here to help per se fix you. It's not just about that. It's about teaching you how to help yourself. And that's really what I'm doing. I'm a teacher and I like being able to teach people.
Well, right. The root for doctor is docere, which means
Right.
teacher, and so you take
Right.
that very seriously. You can't come home with us and make us take our supplements and cook our food for us and make us go for walks, and make us drink our water. You have to
Right.
teach us so that we go do it ourselves.
Hmm.
The hope needs to be installed. It needs to be shared that we really need to believe. The first thing we need to do is believe the body can heal itself. The things I've seen the body heal are so miraculous. Using Dr. Wallach as an example, he has helped thousands of people get off of dialysis, no longer need dialysis when they were told they would be on dialysis for the rest of their very short life.
Hmm.
And we can heal our body to the point where it recovers, even when we've told it won't ever recover. So, who are they to say you can't heal yourself? We first have to, decide that. Yes, there's always a point of bifurcation where there's always a point of no return, right?
Hmm.
There's always that. But are you there yet? And who's to say that you're at that point, right? There's we should never give our personal power over like that. And we need to fight right to the very end. And so doing things like supporting the body's ability to heal itself, even if you're on dialysis, change your diet. Obviously take supplements that, work with a doctor that knows kidneys and knows dialysis, and so that you can take the supplements that are in alignment with you right now. But take the herbs, change the diet, change the lifestyle, and do it in a way to support your kidneys, and maybe your body will get so healthy you no longer need dialysis, or maybe you get so healthy your dialysis gets cut in half, right? Either way, you're supporting the body as a whole. And it's just so important that we don't give up and give our personal power over to someone and just say, oh, okay, whatever this doctor says, that's just the way it's going to be. It's ludicrous, right? We're giving over our personal power when we do that. We need to fight and keep educating ourselves and keep learning from doctors like you who have alternative information that is science-based and that empowers us. Why is it? We have to question, why is it that not all doctors have this information? We have to advocate for ourselves and go to different doctors, go to different holistic doctors, go to all sorts of different professionals who have different perspectives and different pieces of the pie, so that we can help our body heal. But never take no as an answer. Never believe that our body is just breaking down and we're done. That's just it so upsets me when I hear someone with type 2 diabetes was told they'll always have type 2 diabetes. They just have to be on this medication the rest of their life. They'll always have it. And that should be a crime. It should be honestly be a crime to be told that, when it's easily reversed. It's reversible and easily reversed all the time, under the care
Hmm.
of the right physician, under the care of a naturopath, or under the care of a doctor that practices holistic medicine. So under your care, you're supporting your clients and your patients in having optimal kidney function at any stage.
And I think, kind of to second, what you just said, I think the theme that I want the listeners to keep in their minds is stay curious. If somebody says, no, this is not possible, uh, just stay curious and go look somewhere else, because you'll probably find the answer that you're looking for. This world is a very, very large world with a lot of different opinions, and the US is not God when it comes to medical, or I should say healing information. They're certainly not. And so there's different things that are great here, but if you're not finding the answers that you're looking for, stay curious. That would be the thing I would definitely want you to keep in your mind, because that has really been helpful for me. I think a lot, um, and I was curious, and so I just went for it. I didn't even think about it, honestly. When I was doing all these things in my 20s, I just did them because I saw the possibility. And as I learned more, I realized, oh, there's more, and there's more. So just stay curious.
Stay curious. I love it. Awesome. Thank you so much, Dr. Devin Miles, for coming on the show today. It's been such a pleasure having you here.
You're welcome, and thank you for inviting me to be on the show. And I just want to mention to everyone that I am doing telehealth consultations. So even if you're not right here in Texas, I am reachable.
Oh, fantastic. That's great information, especially nowadays when we can't even see our doctor in person. Might as well
Right.
call you up.
Yeah. I mean, and that's what I mean. Go find the answers that you need, even if they're not right in your neighborhood. They're somewhere else.
I hope you enjoyed today's interview with Dr. Devin Miles, holistic naturopathic physician, and how you can support your overall kidney health. I did mention the supplements that Dr. Wallach created, the mineral supplements that has the very bioavailable form of calcium that's really supportive of the kidneys, and in some cases helps to even prevent stones, especially when the person has a mineral deficiency. If you'd like to try those supplements and talk to an expert on them, please go to takeyoursupplements.com. You will definitely love those supplements. I've been on them since 2011, and they have helped me to reverse my health issues and conceive our child naturally. So I have a whole story I've shared in the past, and I'm going to be publishing very soon my interview with Dr. Wallach, who just turned 80 years old and is still a very active and practicing naturopathic physician. He is my hero, he's my mentor, and he is the creator of the supplements that I take and the supplements that we sell at takeyoursupplements.com. So please go to takeyoursupplements.com and check them out. I absolutely love them. I highly recommend them. They are bioavailable, all natural supplements so that we can make sure that you have all 60 minerals in your life, in your body, so you don't have a mineral deficiency. Excellent. Thank you so much for being a listener and sharing this episode with those you care about. Let's help as many people as possible to learn true health.